Welcome to our teaching video about the event reporting system at Augusta Health. I'm Clint Merritt. I'm the Chief Physician Executive at Augusta Health.
I'm Kelly Carter. I'm a Safety Management Coordinator in Quality.
So Kelly and I are going to walk through the changes we've made to the event reporting system as we implement the Expanse electronic health record. And I want to share first just the value we have in the event reporting system. So we've really grown our event reporting over the past couple years as the foundation for our quality and safety program. Right now we receive about 10 events a day from across the health system about safety events and near misses and workplace violence events. And they really allow us to learn every day what are the opportunities that we're seeing and how do we learn from today's events to be better tomorrow. And the foundation of all that is a really robust event reporting system. And Kelly and team have designed the event reporting system in Expanse to be far more streamlined than the system we've had over the past few years. So we're going to walk you through all that. But first I want to ask Kelly, what is a safety event? What should I be reporting and putting in the system?
An event report really is anything that is unexpected that happened, whether there's a deviation or in just workplace violence events. It can affect a patient, a visitor, a team member, or just our systems in place. This includes near misses, things that almost happened but didn't happen. Those really help us learn to be safer the next day.
And Kelly, if you're not sure, if you're wondering, gosh, is this something I should share? It might be something worth sharing. What advice do you have if people are uncertain?
You never need to be 100% sure. Just go ahead and report it anyway. We have a group of people that review it every day and every week, and we weed through them to see what needs to be done and if it's actually an event or not. But if you're not sure, just go ahead and report it.
Just go ahead and report it. You know, one of the things we find when we read the event reports every week is there's a range in in the quality of the event reports. And one of the teaching points we have about event reports is stick to the facts. When you enter an event report, and you'll see us do this in a minute, we'll walk you through it, we really want the very specifics about what happened when and who was involved. What we don't want is a lot of sort of evaluation of who did or didn't do something right, or even your editorial thoughts about the event. Sticking very much to the facts of the event, then what we do is we take those events, we take the facts, and then we connect with people involved to figure out the learning from events.
It's about systems learning. It's never about blaming or pointing fingers. It's How can we make our system better and safer tomorrow?
Yes, the case debriefs that we do from the events, they lead to meaningful improvements in the health system. Sometimes they lead to really large initiatives like our med safety campaign. That came out of our event reports. So with that introduction, Kelly's going to walk us through the new event reporting system in Expanse, how you access it, and how you put an event, and how we've made it easier for you.
Yes. So as we look at the screen, there are two different screens that you might see. One of them is the provider screen or your clinical screen. The other screen here is what everybody else will see through our non-clinical teams. Each method of entering an event report is the same. We click our help button and click report an issue. What would you like to report? And that's an incident. It's automatically going to populate which facility you're working with, whether it's the hospital or AMG. You click our down arrow, you can choose between a patient, a non-patient, or an employee event. Or incident types, click a down arrow, and it's very streamlined on what you can report. For this instance, we're going to choose a process or procedure event, and then we have codes to help us better trend and aggregate what's actually happening across the organization. We do have the functionality of entering anonymously in Expanse, so you can click yes or no. Our identifier is where you'll put your patient information. And here is what our event reporting looks like. It is streamlined into one page where there's an asterisk is what is mandatory to report. So for event date, you can click a T for today, where there is an option to look at the calendar. The same thing for the time. You get to choose what time that event occurred. So for this instance, I'm going to choose now. All of the locations across the organization are in here, even things such as the parking lot or sidewalk. For this instance, we'll choose a medical floor to west. And you can say who it's reported by. So if you're not reporting it and somebody's reported it to you, you can add their name here. Description of the event is where we put just the facts, no opinions go here. We'll just type in test and click OK. Next, we're just a few questions. Did the event reach the patient? Yes or no? Was there harm to the patient? And if there was harm, we just ask that you give us your opinion of what the harm was. There will be a team that investigates that further. You can choose who was involved. You can choose it was a nurse involved, and then you can type in the employee name of who was involved. Click OK, and then who did you tell? If you told anybody about the event, so who was notified? Typically your manager would be notified. So we'll click manager, and then we can choose a manager here and click OK. And then that is all. You click, there will be a thank you note down here at the bottom to let you know you were done with an event report, and you click save. And your event report is filed.
And that's it.
That's all.
You really made that so much shorter. There were a series of tabs before with lots of fields that you had to fill in. So this is twice as fast, maybe 3 times as fast as it was before. What happens then when somebody goes through that and fills out an event? Where does it go next?
So it goes directly to the manager of the unit that you selected and our safety and quality teams. From there, they're reviewed daily, they're reviewed weekly to see if there's any processes that we can change and make things safer.
And who in the organization is going to receive this training? Who's expected to know how to fill out safety event reports?
So everybody in the organization has access to event reporting. Our providers, our nursing team, EVS, laundry, our nutrition team, everybody, even our volunteers, are able to enter an event report.
Fantastic. Is there anything else we should share today about the event reporting system?
I don't believe so. What you famously say is, what can we learn today to be safer tomorrow? And I think that is the pivot point of our event reporting system.
Well, thank you, Kelly. You and your team have done a beautiful job creating a much improved event reporting system.
Thank you.
I also believe our data is going to be better coming out of it, so thank you.
Absolutely. Thank you.
Thanks for watching this video.